All right, good morning. Welcome, everyone. We're glad that you're able to be with us today. We're really excited to have Tom Wolf here. He's a national expert and on community engagement. We have been requiring that our coalitions have community engagement in the past, but this year we're really focusing on it. A lot of times we think that we're doing community engagement, and in fact we're just doing outreach or we're coordinating formal organization partners. This training is designated to teach each of us the difference. We're providing this training so everyone is on the same page about what it takes to have true community engagement, and understand that we will be looking for these specific strategies in the grant reports, from the CHAT grantees to the maternal and child health grantees, the Healthy Community grantees, and the Health Equity grantees. I have in the room here with me today, this is Shelley Canada. I'm sorry I didn't even introduce myself. I'm the Community Health Action Team Program Manager. I also have Elaine Russell, who is with the Obesity Program, in the room with me. I have Ariel Arthur, who is with the Office of Health Equity, in the room with me. I have Shelley Wingate, who is with the Healthy Communities, in the room with me, and I have Erin Hester in the room with me, and she's with the Partnership for a Fit Kentucky. So now we'll go ahead and get started, and we'll let Tom take it away.
Great. Well, I'm delighted to be here. And let's see, what does it say here? They're sending me a message. I'm the presenter. Okay. I'm delighted to be here. Can you hear me?
Yes.
Okay. I'm a community psychologist in Massachusetts, and I've been doing coalition building on a wide variety of public health topics and other topics for over 40 years. And one of the key issues that almost all communities deal with when they're looking at this issue of coalition building is community engagement. And I know in doing the planning with the folks who are introduced at the beginning, one of the sighs of relief came when I said, everybody's struggling with this, because we are. But I think what I want to do this morning is give you a sense of how critically important community engagement is, what it gets you, and give you some very clear and I hope simple steps to increase the civic and community engagement in your coalitions. And we'll start.
Excuse me, Tom.
Yep.
Could you put your slides in presentation mode?
Could I put my slides in presentation?
Slideshow, where it says slideshow?
Slideshow. Yes. Is it going there?
Yes, from the beginning. Thank you.
There we go. All right. So as we proceed here, and I'm going to proceed with my arrow, that's going to do it? Yes. And I'm going to turn my picture off so I can attend to this, and we can go at it. We're going to start with an exercise I usually do physically with people in the room, but we're going to do this with a poll, and I'm going to ask you some questions about what you believe about collaboration. Okay, and the first poll is going to come up. There'll be a statement, and then there are 5 options. Strongly agree, agree, neutral, disagree, strongly disagree. And those options will appear on the side, I think. But the slide is not moving. I'm hitting the arrow. Hello?
You'll want to click on the PowerPoint again.
Click on the PowerPoint again?
Yes.
And then the arrow? Okay, got it. Thank you. Sorry, you're going to have to put up with my awkwardness with all this. Collaboration with all representatives from all parts. Let me get rid of this. I can't read what I got here. Collaboration with representatives from all parts of the community is fun and easy. And is there now a poll that people can see? Can people see a poll? No. Well, you need to.
They can see your poll.
Okay, so everybody take a choice. Where are you? Do I see the results? No. Oh, here we go. Okay, take another minute. Collaboration with representatives from all parts of the community is fun and easy. Okay, it looks like the voting is in. So, in terms of strongly agree, 4%, agree 17%, neutral 27%, and disagree 44%, and strongly disagree another 8%. So we have over half the people who disagree with the statement. And having done this with hundreds of groups all across the country and in other countries, I think a lot of people will say it can be fun sometimes, it can be easy sometimes, but it's often very hard, and it may not often be fun. But it's good to know that 20% of the people agree with this and have had those kind of experiences. So this is just about your experiences and your feelings and your beliefs, not about what's the reality. So let's go to the next one, and we'll do the same thing with another poll. And I have to click on again, and then go to the move. Okay, in collaborative efforts, in our community, we always engage those most affected by the problem as equal partners at the table, and they willingly join us and participate actively. In collaborative efforts in our community, we always engage those most directly, most affected by the problem as equal partners at the table, and they willingly join us and participate actively. Go to the polls. Your chance to vote. Okay, take another couple of seconds. I think the voting is 80% has voted. You need to be decisive here. It's fast. Okay, well, we're getting a sense of it. 82% voting. So 19%, almost 20% strongly disagree, and 59%, almost 60% disagree. So we're talking about 80% of you disagree with the statement. And then there's some who are neutral, and only 8% agree. And I think that can represent a lot of things. It can be your experience, it can be your attitude, it could be your beliefs. But we're going to talk about why it's so important to engage those most affected, and then we're going to talk about how we move forward based on that. So I'm going to start with the 6 principles for successful coalitions that are part of my book, The Power of Collaborative Solutions. And I'll go through these in some detail, but it's engaging a broad spectrum of the community, encouraging true collaboration, practicing democracy, employing an ecological approach, taking action, and engaging your spirituality as your compass for social change. And each of these is a critical piece of what we're talking about. So let's start at the beginning. And as I go, if you have questions, there's a place to put on questions. If a lot of questions are coming up, then I think our moderators may intercede with me and ask me to deal with them now. Otherwise, we'll talk about them at the end. Engaging a broad spectrum of the community is really critical. You need to have those most directly affected by the issue in the room. Otherwise, we form a coalition to deal with the new Cambodian community that's moved into your community, and we do it by not talking to the new community, Cambodian community, and we're just sort of guessing. What are they looking? What are they thinking? What are they looking for? What are they wanting? And that's a pretty dangerous game to play because we then invest in approaches that may not work. We need to celebrate the racial and cultural diversity of our communities. We are using words like be sensitive to, tolerate, but the truth of the matter is what's made America great all along has been our diversity on all levels. And we need to understand that in our communities and celebrate it as a way of being able to address what's going on. So we need to get that broad spectrum, and we'll talk about who you have and who you don't have in the room and how we get those who you're missing. We need to do true collaboration as the form of exchange. My colleague Arthur Hillerman has talked about this. When we go into a room and we call it a coalition or a partnership or a collaboration, lots of different things happen. And he defines 4 things that we're going to look at. And each one of these is an important piece. And as you go along and address more of them, they become more powerful, but also more risky and more difficult. So we start with networking, exchanging information for mutual benefit. This is what we do in the coalitions all the time. I would imagine you're all nodding your head and say, oh yeah, we do that. And tied to this, oh actually I'm going to, yeah, it can be a worksheet that looks at which of these are you doing. But we exchange information. We go around the room and say, what's new in your organization? What are you doing about obesity? What are you doing about exercise? And we exchange information. And that's a building block, but it's not necessarily going to create change. And I sometimes think we put too much emphasis and buy-in to this idea on the hopes that if we exchange information long enough, things are going to change. And there's not much data to back that up. Exchanging information for mutual benefit is a building block. So what do we build to? Well, we build towards coordination, exchanging information, and modifying activities for mutual benefit. Let me give you an example. We were in a small rural community that had experienced a big plant closing, and we were concerned about how the homeless were getting fed warm meals during the week. And we asked the coalition, they said, well, you should go talk to the clergy. So we went to the Interfaith Council, and there were 6 churches there. And we said to them, you know, you know, who's serving hot meals? And one of the churches said, oh yeah, we do on Sundays. We always have a hot meal when our congregants are there. And then there was another hand that went up, and we said, so there are 2 of the 6 churches who do that. When do you do yours? And that church looked a little sheepish and said, well, we do ours on Sunday also. Small community, 6,000 people. They didn't know that the only 2 hot meals in the community were done on Sundays by the 2 churches. Since they were churches, they agreed to move it, and so one moved to Wednesday and thought that would be fine. That's called modifying activities for mutual benefit. Now, sometimes if you did that with hospitals who are in great competition with each other in a community, instead of moving to Wednesday, they might say, well, what we're going to do is we're going to put up more signs advertising for our free meals on Sunday so that we beat you out, because our system can be very competitive. So it doesn't always happen that they're modifying activities, but when you bring people in the room, one of the things we can do is we can get people to change the way they do things. If there are groups wanting to engage parents, we can say, well, we're going to have our workshop next Thursday, and another group can say, well, we were scheduling ours for Thursday too, but we can move it. So that's an important step, and you can look, are our coalitions going beyond exchanging information? Are they now starting to look at modifying activities? The third is cooperation. You'll see each of these builds on the one before, adds another level, is more powerful in creating change, but also is riskier. Because now we add sharing resources. And as soon as you say sharing resources, everybody at the table reaches into their hand and touches their wallet and says, they're not getting my money. So we have to talk about how does that work? And in order to get people to share resources, we have to have a common purpose. So often when we're in a coalition, we have a common interest. Everybody's concerned about young kids and their physical activity. So we come together and we share information with each other about what we're doing. But if we don't have a common purpose, we just have a common interest, then we're not going to go anywhere. So to have a common purpose, we have to have a process where we create a vision, and then we buy into the vision and we commit ourselves to that vision. And that'll lead to cooperation. So what's an example of sharing resources? Well, in one community, they were concerned about the Hispanic community, and the Hispanic community was having a neighborhood fair, and they were renting tables out for $75, and 3 agencies chipped in $25 apiece to share a table and put all their brochures and information out on the table. That's a low-level resources, $25 apiece. In Springfield, Massachusetts, there were a series of public health grants that all had a little bit of outreach money. And everybody agreed that what we needed to do was to go door to door in the Latino neighborhood. And the question was, how are we going to do that? No one has enough money to hire someone who will go out and do door to door. You don't do door to door with a third of an outreach worker. So they pooled the money from the HIV grant, the teen pregnancy grant, and the substance abuse grant. All those outreach works were put together in one agency, who then went out door to door and talked about all 3 issues. That's my definition of collaboration, is doing together that which we can't do apart. doing together that which we can't do apart. So they couldn't do outreach. If they didn't pool the money, not a single door was going to get knocked on. So they pooled the money, and then they were able to knock on doors and raise all of these three issues. Now, if my organization was the one that had the HIV grant, and another organization is going to be the one that goes out there and knocks on doors, I got to trust that they're not going to just talk about what their grant was about, which was substance abuse, but they'll also talk about what I want and I'm funded for, which is HIV. And that requires some trust. So cooperation is a higher level of trust. There's more on the table. There's resources on the table. So you're following this, but it's more impactful. We wouldn't have knocked on doors unless we share resources. You may be nodding your heads, but think about how often does that ever happen in your communities, that agencies reach into their pocket and say, we're so committed to wanting to reduce obesity that we're willing to pool our money to make something happen. And finally, collaboration, which is what we talk about all the time. It takes everything we had before, but now it's about enhancing the capacity of the other. So if a neighborhood association and a hospital are working with each other, generally what the role is that the hospital is giving charity to that neighborhood association to make the neighborhood association better. In collaboration, the neighborhood association is also trying to make the hospital better. And they can do that by giving them feedback on how their interpreter services are working around language. They can do it in many different ways, but it's a mutual relationship where they share risks, resources, responsibilities, and rewards. And so that's a high-level exchange. And you can look at your coalitions and say, are we really doing that? The third is to practice democracy, and where we promote active citizenship and empowerment. And as we talk about bringing residents to the table, those most affected by the issue, getting community engagement, we have to think about how are we going to make this work so they come to the table and feel that they can be active and partners. If you have ever gotten a resident to come to a table and then you go around and introduce yourself, it often goes like this. I say, I'm Tom Wolf from Tom Wolf & Associates. Elaine says, I'm Elaine from the Department of Public Health. We are also excited that Jane is here. We turn to Jane and say, hi, Jane, introduce yourself. And she says, I'm just Jane. I live in the neighborhood. I bet you've heard that. I'm just. And what she has now done in doing that is she's discounted herself as having any contribution to the situation. What is it about the situation that draws that response? I'm assuming you're nodding your heads because I've done this in hundreds of communities and people have seen that and have that happen. But what it does is you bring someone to the table and they're not going to be active participants because they don't feel that they're being listened to. And if we have a discussion that goes like this, which is, well, did you see the new DPH RFP that came from CDC number 742 that's part of the new initiative on 1272, then they look at each other and they think, I don't belong here. These people talk Greek and I don't know what they're talking about. So we have to think about, what do we do? I was in a coalition once that had a fine for using acronyms so that we would be welcoming to other coalitions, and you flipped a quarter into a jar in the middle if you used an acronym during the meeting, and they used that money to buy their coffee and their refreshments for the meeting, and they were able to go to Starbucks because they made so much money, because it's a very bad habit to be able to break. So we need to set up an environment where people can be heard. When you do an exercise, and we'll be showing you some exercises, where you say to the community, everybody at the table, write down your vision. And then if you say, now let's open it up and talk to each other at a small table, then the loudest voices will be heard first. If instead you say, everybody write it down, now go all around the room and everybody say what they wrote down, then you guarantee that the person who may be most intimidated has a voice. So this is practices you can develop in your coalition that if you get people in the room, you can keep them there. We need an ecological approach that emphasizes the individual in their setting and building on the strengths and the assets, not just the deficits. And John McKnight has done an analysis of our industry, and if you haven't looked at his work, you should, where he says that we're a deficit industry. We look at a community and we write up a needs assessment chart that looks like this graphic: illiteracy and gangs and rat bites and drug abuse and pollution and child abuse and homelessness. Would we ever share this with the mayor of the city? My God, no, because it's such a negative view. But we feel we need to write this in order to justify getting the grant money. But when we look at a community that way, they know it. And what we don't know and we don't look at is the community's assets, and think about, what are the strengths of this community? How do they see their community? What do they see the strengths to be? The citizen associations, the religious organizations, the individual capacities, the gifts of labeled people. We call them homeless, but they can be incredibly helpful in our work. We call them obese, but they can be an incredible asset in the work we're doing. But we label them and then they become a deficit. So when you do needs assessments with a view towards this deficit asset approach, then you ask different questions, and you start asking the question, not just what are the problems and how do the system solve it, but what are the strengths of this community? If you haven't done that, do it. Go ask a community meeting, what are the strengths of this community around anything you're working on, exercise, obesity, anything, and then ask them, who of you here is willing to work with us in solving this problem? And you've changed the whole frame about how you look at the residents. When they think you're looking at them as a deficit, they're less likely to become engaged. You need to take action to address issues of social change and power, to move from a social service model to a social change model. You have to have a common vision. When you bring residents to the table and there's not a sense that outcomes matter, that you could sit there for years and talk about the issues and maybe issue a report, but it's not going to make a huge immediate difference to their kids, then you don't necessarily keep them at the table. And finally, engage your spirituality as your compass for social change. Now you hear spirituality and you say, Tom is talking about religion. We can't put religion into our work. I'm not talking about religion. I'm talking about what drives people to want to make their communities a better community. And want to, if you dream of a community that is going to be a loving community, how do we bring that lovingness into the room? But the work you do and the people who come to your coalition are motivated by something higher. And we don't have to get into a religious discussion, but to know that we need to call upon that when we ask them to work with us. So let's define community to begin with. Those most affected by the issue. So think about your work. And then think about who are the people most affected by the issues you're addressing. List the 5 groups of people who are most affected in order of importance. So here you have worksheets. And you could just take a minute to just jot down who are the groups that are most important. If you're working on maternal child health or exercise or obesity or opiates or whatever. And when we think about inviting people, we're going to look at this list and say, we need to engage these people. Now, I can't see your list, so we can't talk about it in this setting so easily. But what I'm not looking for is, if we were trying to address, for example, a new immigrant community, I'm not looking for the agencies that serve those immigrants. They need to be at the table too. But the people most affected by any of the issues we're talking about, let's say opiates, are the people who are addicted, the people whose families are involved, the employers who are coping with these people. These are the groups most affected. They are not the most likely groups we have that we're going to bring to the table when we want to talk about opiates. So we have to think about who's most affected, and you need to do this, everything I'm doing with you, because there are 230 of you, that means you're out there in 230 coalitions, you need to go back and do with your coalition if you want to address this issue. And you say to them, who's most affected by whatever we're working on? And why? Then we have to sort of sell people on this issue. Why is community engagement important? Why is it central? It's critical to the process. We have to have the community at the table. to learn about the issues we're trying to address. We know them from a statistical point of view, and we know them from the agencies that serve these people, but we don't know them from the people themselves. We need to learn about what we call the target community. People are not in love with being called a target community, but we often use that language. But we need to learn about them. And then we have to share power and resources with them. And that becomes scary. Many of us in the world, I can include myself, have a bit of control freak in us. And so are we really willing to give that up? We need to build community ownership. This is the bottom line. In public health, you cannot keep campaigns going for 20 years on smoking and on obesity, etc., unless you start to get the community to own it. Watch what happened with smoking. The communities now own the idea of non-smoking in the community. It's not a public health thing that you're nagging at them about. When the community owns it, it's a different game for us. So if we're talking about kids eating healthy food in schools, then the community starts to own the changes, and they know what that's good for themselves, and it's not just us pushing it. We're doing with versus doing for. And if you've ever been in the position of people who are doing for you versus people who are doing with you, it's a totally different emotional experience. We need to align with community organizations, and we need to identify the community leaders and key partners and develop relationships with them. This is all about going out there and building relationships. And we need to honor that the community residents know things and experience things that we don't. So you go into a community and the guy from the hospital arrives in the poor neighborhood and says, "Hi, I'm from the hospital. I'm here to help you. I want to know what your issues are." And they smile and they say, "Oh, yeah, they send us one every September," and nothing ever happens. But we don't know the history. We don't know what their experience has been like, so we don't know that information. What are the elements for true collaboration with community members? You got to build trust. They got to be able to trust you. We were working once with a mayor who had a buddy who was going to redo the local police station into a youth center. And we convinced this guy after 3 months that he should talk to some young people. Excuse me. And the young people came to the meeting, and he said to them, "Well, what do you want out of the new youth center at the police station?" And they said, "We want dances on Friday night." And he said, "Well, we're not going to do that. What else?" And the trust was broken. We have to listen to what the residents tell us. We may not be able to do all of what they want, but we have to acknowledge it, and we have to do the best we can to get there. We need to provide safe space so that we can talk with each other. We need to be accommodating the members. How do we do that? Well, we don't meet during the day. We meet at night when residents can be there. We need to provide language translation. We need to provide transportation. If it's an evening, provide daycare and a meal. And this may, shock people, but I'm very willing to offer stipends of a $25 certificate to the local grocery store for them coming to a meeting, because everybody else at the table is getting paid. Why shouldn't they? You need to be inclusive and honor the diversity of the membership. We need to acknowledge the diversity and give everybody a fair shake at the table. And we need to share governance and decision making. And we'll talk more about that. That means us giving up some of the power. What are the benefits? We can reach the yet-to-be-reached populations. We're often talking about this. We've done great work in the schools in terms of reducing substance abuse, but we haven't reached the people who are the highest users because we don't have a link to them. But if you work with the neighborhoods, they have the link. They know how to work with the informal leaders. We know the formal leaders. If you go in a neighborhood, you say, who do people turn to for help? Who are the people? And they'll start to identify the neighborhood informal leaders who can really move opinion. They know what works in their community. We don't. We may think it's a good idea, but we don't know. There are also the community historians. They'll tell you, "Oh, no, we tried that. That doesn't work here. They did that last year from another agency." And we don't know that stuff. They promote ownership and participation. At the end, they own it. They're the best architects of the solution. They know how to design what's going to work. And they build local leadership, and that's what we're looking for. We're not looking to be the leaders on these health issues that you're working on for the rest of our lives and the rest of the department's lives. They have got to start to own it. And when we don't give up control, they'll never own it. And they create the positive norms, which is really what we're looking for. That's the smoking norms, that's the eating norms. You know, you can change what the cafeteria serves in a school for food to kids, but you can't necessarily change what the parents send in from home. And if you start to get parents to, you know, say to each other, you know, you send in Twinkies every day, and your Johnny and my Jimmy are best friends, and I'm not letting Jimmy have Twinkies, and I'd really appreciate it if you didn't add to that. You start to change the community norms. This making sense? So the approach you take matters, and there are two kinds of ways of thinking about this. And here, I believe we have a worksheet, the next worksheet, where you can look at your work and say, is it agency-based or community-based? And these are not two separate items. They're really on a continuum. The drawing doesn't show it. Are we going from a weakness-deficit approach like McKnight talks about, or are we looking at the community's strengths? Agency-based is weakness and deficit. Who defines the problem? Almost always it's the agency and the government, not the local community. I did a lot of work on neighborhood violence a number of years ago. And it was real different if a group of neighbors said, you know, there's a crack house on our corner, and we're addressing it on the neighborhood level, but we need the cops and public health to come in and help us address this issue. That originates at the community base. But very often, and you're all tied to the department identifies an issue, says we really have got to deal with opioids or teen pregnancy this year, and here's what the stats say are the, you know, 5 parts of Kentucky where this is the biggest issue. Go in there and create a coalition. So you're coming in saying, we know you've got a problem. And that's not a great approach. And so there's some difficulty when we define the problem. It's like someone coming to my door and saying, are you Tom Wolfe? Yeah. Oh, well, we got your weight and your height and what you've been eating, and you're a mess. Can I come in? And I don't think I welcome into my house. And we do that often. We come into a community and we say, your teen pregnancy rate makes you a mess. Can we come in? So you have to think about what's the weakness of our agency-based approach? What's our role in these models? We're central to the decision-making as opposed to being a resource to community problem solving. Who makes the decisions? Agencies and government does, not the community. And here's the critical kicker. What's the potential for community ownership? When we do it from an agency-based point of view, it's a low likelihood that the community is going to own it. When it starts with the community, they make the decisions, they're, you know, at least a significant part of the whole process, there's much more likelihood they're going to own it at the end. And in fact, that's what we should be going for, community ownership. And I think you all are going for it, but when we do it our agency-based approach, it doesn't work as well. I hope you're nodding and saying, yes, this makes some sense. So let's talk about how we can get out of that. And ask the key questions. And you'll have, again, here's the next worksheet. Who do you have at the table and who's missing? And I'm suggesting you go back to your coalitions and do this with them. What are the strengths and the gaps in your membership? And we'll do this in more detail in a minute. Who's missing? Who else do we need? Who else do we need to have in the room? That's the second click. Who else cares about your issue in your community? So this is another issue, not just who do we need, but a group once came to me and wanted to work on traffic safety, and this was 20 or 30 years ago before that became a popular topic. And I said, how are you going to find anybody in a community who cares about traffic safety? And they said, yeah, we will. And they put out some mini grants of $200 to 5 different groups. And the people who emerged told them a lot. This is a small town of 7,000. Who was concerned about it? The volunteers in the ambulance and fire department came because they were going to the accidents where the kids who didn't have seatbelts on were there. The neighbors in a neighborhood who put up those little handwritten signs that say, slow down, my kids play here, they showed up. The Girl Scouts and Boy Scouts showed up. And all of a sudden, this coalition had a set of allies and members of their steering committee who they never would have imagined. We did this in another community, trying to get the African American community engaged in issues of youth violence. And we put out 4 grants for churches for summer programs on youth and violence, and added all 4 of those churches to our steering committee at the end of a very successful summer. So who might you engage? We can think about this and looking at your communities in 2 ways. And here you have worksheets that I really would like you to work on and to bring back to your community. The formal sector, those are the people we usually invite to our coalitions. They represent the major institutions, the major sectors of the community: government, education, health, business. And those, they have staff, they have offices, they're very organized. The informal sector are those that are best linked to the residents themselves. If you want to get those most affected by the issue, we don't get that from the formal sector, we get that from the informal sector, such as neighborhood associations, PTOs, church groups. Now, I know many of you work in very small rural communities, but I live in a town of 1,700, and there are all kinds of little subgroups in this town, tied to the church, tied to the schools, tied to a sports league, all kinds of things that are there for us to make links with if we want to. So let's look more specifically at both of those individually. The informal sector. So I want you to think about what it says on that worksheet. Who do you presently engage, and who else might you engage? And I think for many of you, you don't have any of them at the table. But you might think about the service clubs, the Elks and the Rotaries. If you ever want to looking for volunteers, no one taps into volunteers, Kiwanis, better than those folks. And we don't bring them into our circle. We should be going. We should be going and addressing the Rotary. We should be going and working with them to be partners with us. Neighborhood associations. You don't even know if they exist, but you can look around and ask. Church groups, not the churches themselves, they're more formal organizations, but churches groups have all kinds of women's groups and youth groups and places to reach those most affected. PTOs. And who's missing? And many of you may not even have these 4, and they may not all be in your community. But you know, you're saying, oh, I'm in such a small town, we don't have any of that. But Saul Alinsky, who was a great organizer in Chicago, the father of community organizing in this country, he used to get a new organizer and he'd say, I don't want to see you for 3 months, and here's the 6 square blocks part of Chicago. Come back after you've interviewed everybody there, and I want to know all the labor groups, all the political groups, all the church groups, all the social groups that exist. And in some ways, you have to go out there and do it. These are not, you're not going to find these groups in a directory. So who don't we invite? Tenant associations, if they exist. WIC advisory groups. Every WIC and every Head Start has to have a parent advisory group. There's a group of parents that we can turn to. So that's the informal sector. And when we bring them to the table, we have to decide ahead of time, what are we going to do with them? Most of the time, on this degree of involvement, the ladder of participation developed by Sherry Arnstein, we put them on the bottom of the ladder. And these are manipulation, decoration, tokenism. We bring in one of a kind, we have them sit at the table and say, well, this whole group is talking about youth who are dropping out of high school, and we have Jack here. By the way, Jack is the first student from our high school ever to get into Harvard. And Jack's going to tell us about the kids who drop out. That's tokenism. One person of color, one Native American. And it's done so we can cover our bases, but it doesn't have anything to do with sharing power. The middle categories are consulted and informed, or assigned roles. And here we go to the community, or some representative of the community, and we get them to tell us what the needs are. So they're as part of the needs assessment, and then we say to them, well, we'll take it from here and design the programs. But the top 3 are all about shared decision making, where you come up with a system where the decisions are shared. And if you're going to invite residents to the table, first have a discussion about this ladder with your group and say, if we bring them in, we need to bring them in at the top. If we're not going to bring them at the top, don't expect them to last 2 minutes. There was a group in Boston, and I'll talk about that coalition later, where the Commissioner of Public Health started to understand that dynamic. She sat in the room. This is a coalition on racial and ethnic disparities on breast and cervical cancer. And when they started at the beginning of the meetings, in the old days, she used to say, I'm Barbara Farrar, the Commissioner of Public Health. But as they learned what that does to sense of discussion in the room, they went around and Barbara would say, my name's Barbara Farrar, I live in Jamaica Plain. That was a neighborhood of Boston. And everybody introduced themselves by their neighborhood. And that created equal access in the room. With the formal sector, these are the major institutions. You know this much better. These are the people you do have at the table, the healthcare providers, the hospitals, the schools, the Head Start programs. But often we're missing faith-based organizations, businesses, elected officials. How many of you bring the business to the table, or the elected officials, the mayor, the selectman, the state representative, or the churches? These are all people who have a big influence on the kind of issues you're wanting to impact. I remember once a Kellogg project working with churches in the South, and there was a black minister who was a runner, and he was in great shape, and he went to the Sunday potluck, and he said to the women who were doing the collards, he said, you know, I'd love to eat your collards, but you got to take that ham hock out of there, and you got to put in a smoked turkey wing. And so he was doing nutrition education along the way. Once you've identified who you have and who you're missing, then you can put at the top of the column, and again, here's the next worksheets. And I really am hoping they're going to go back and do this with your coalitions. You can put at the top of the column in the formal someone you're missing. You were saying, well, you know, we don't have the media there. We really need to get the newspaper to come regularly. They do a lot of stories on opiate deaths. Let them come to our coalition meeting. And on the informal level, you know, we don't have any representatives from the people who do sports leagues. And what an incredible access that could be to finding kids. And then you have to ask, how are we going to invite them? So you start by saying, what are their skills? Why are you interested in inviting Jack from that newspaper? Well, you're going to say because Jack's covered this in the past, and we know he's a good guy, and he would be really helpful to our PR committee. And why do you want to invite Jane, who coaches the softball team? Because Jane knows everybody, and she's really committed to kids being healthy. So she would be terrific on our coalition. Now that's different from going to either Jack or Jane. Let's say Jane is African American and inviting her and not telling her that, because then Jane knows, oh, you need an African American woman on the coalition. I'm not so sure I want to fill that role for you. You're not saying what you think I can bring as a person. And what's their role? Well, I talked about it in the introduction, that they would be part of activities that the coalition is presently doing where they need their skill. And what's their self-interest? Why should they join? What's in it for them? Well, we don't know that. And that's what we'd ask them in this first phone call invitation. We could say, well, can you imagine what that might do for you? Well, yeah, I'd really like to get human interest stories on that second page. So yeah, this could help me. And then how are you going to recruit them? And the basics here is that if someone knows them, they're more likely to participate. So who do we know who could invite them? What barriers might exist? Well, you know, Jane works and is also a softball coach. We're going to have to find an evening that could work for her. And then you decide who's going to approach them and when. If you do this, you will end up with new members. What we generally do is say, oh, if we only had someone from the media. Yeah, we could really use someone from the Gazette. Well, maybe someone can think about someone and invite them next time. And you come back, and of course, with that kind of vague discussion, no one has done anything. And you do have the discussion again 6 months later, and you still don't have media coverage. So you really have to do it this specifically. Even just a variation of this will get you further than your present discussions. I hope you're nodding your heads and saying, yes, 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 and this is not too complicated. We could try this. Now, the other thing to know is that the main reason that someone volunteers is that someone they know asks them. So especially in rural communities, if you know someone, you're going to say, does anybody know them? And then someone's going to say, yeah, my daughter's on a softball team with her daughter, so let's do it that way. Now the question is, once you get someone to the table, why do they stay? Well, they did research on 10,000 neighborhood associations in New York, and they found that these were the 6 R's that kept them there. Recognition, role, they had a role, there was some respect for them. How do you show respect? Well, I greet them very nicely and shake their hands? No. We meet at night, we provide them a stipend, there's babysitting, there's meal, there's transportation, there's translation if they need it. That's the way we show respect. And we means modifying what we're doing. We can't hope to get residents and those most affected to the table unless we do some willingness to show some willingness to change. There's a great manual out called Kids on Board, which is about training adults how to behave when you bring youth to the table. It's Youth on Board, I'm sorry. And because it's not just getting them to the table, it's getting us to modify the way we talk to them and respect them. Relationships, rewards, results. The residents, more than anyone else, are going to want to see results. If they're concerned about their teenage kid, and this is a group working on issues of adolescence, the rest of us can sit there working on our grant on adolescence, and if we sit there for 6 months and we haven't produced anything, it is not hugely disturbing, but the parent wants to know that things are happening now, and so we have to respect that if we want to keep them at the table and get some, low-hanging fruit, some short-term results. So what happens if we fail to involve the community? We create a program that no one wants. You all can nod. You've all done those. I've done those numerous times. You build a youth center that no one attends. We trap ourselves in what we're doing for and never can get to doing with. The community may never own the issue. Whoops, skip that. And we fail to respond to the diversity and culture of our communities. So let me give you an example. Here's a rural community, set of 9 towns, population 35,000. In a coalition we began in 1984 with a major plant closing. Great economic challenge that continues to the day. And we were called in because there had been some medical students who said, oh, there seems to be some issues with this plant closing that people don't know what to do. It's in a gorgeous area of Massachusetts where the water for Boston, the Quabbin Reservoir, is right there. But this was the plant that closed. And it still hasn't opened. And there was just a huge economic downturn. So we created a coalition that was going to be a planning body, promote greater cooperation, collaboratively solve problems, develop an advocacy capacity, provide information, and monitor success. That coalition is still going 34 years later. This is a group of parents, of low-income parents who are working on literacy and parenting skills, meeting with their state legislators around welfare reform legislation. They wanted the meeting was set up by the coalition, and they had a say. When you do that, when you take the residents who are the most affected and put them in the room with a legislator, and the legislator listens to what they're saying, you're building an enormous amount of self-respect, and you're building empowered residents who will continue to work with you on the next issue. We started in this area doing an information referral. We moved to doing a family shelter. Then we had annual retreats and always looking at the next issue. And then we would respond to whatever DPH was putting out as the issue of the year, but we had a core of doing this for the community. They created public transportation issues, affordable housing issues, healthcare access solutions, economic development, and they created a grassroots approach to child abuse prevention that was known as Valuing Our Children. And it started by going around the neighborhood with a blank brochure that said valuing our children on the outside and nothing on the inside, and saying to the parents who lived in that neighborhood, what do you want to see us do? What's going to support you in raising healthy kids in this neighborhood? And how can we support you to be a healthy parent in this neighborhood? And they told us what needed to be inside. So we did leadership development, and the graduates of that became the board and the staff of the agency. They became members of our committees in the coalition. But it was an incredible asset for the community that we'd created this and created it with a model of building what would normally be called clients into community resources and leaders. So when you take this approach, many benefits come your way. So you're saying, that's nice, Tom. How do we do this? How do we engage the community? Well, we have a lot of tools. First of all, the main thing is you got to go out in the community. You cannot engage the community by sitting in your office in front of your computer screen. You got to be out there. Door-to-door visits. Now you say, oh my God, no one does door-to-door visits. Well, the Department of Social Services wanted to do a new child abuse prevention program in neighborhoods. They identified the 6 neighborhoods in the state they wanted to start with. They brought the social workers from those neighborhoods to the office, and they said, we want you to start going door to door to talk to the families in this high-risk neighborhood. And the social workers looked at them and said, who do you think we are? Jehovah's Witnesses? because that's the only group that people know who knock on doors. Well, that's not true. Political campaigns knock on doors all the time. When you knock on the door, you're saying to someone, I really want to know what's important to you. Community meetings. Go to their meetings, not invite them to your meetings. Create public forums and listening sessions as part of what they normally have as meetings. House meetings. We were doing Teen Pregnancy Coalition work in Holyoke, predominantly Puerto Rican community, and we held house meetings, they call charlas, house chats, where one neighbor in an apartment complex invited all the other people in the building. Street outreach and tabling, where you go literally out, especially with young people, go out into the streets and where they're at, basketball hoops or wherever, and tabling in front of stores. And focus groups that you most likely know about. And then Photo Voice. And if you haven't used or know Photo Voice, go check it out on the web or go to the community toolbox and check it out. But Photo Voice is putting cameras in the hands of the at-risk, the population that's most affected by the issue and say, go take pictures and show me how this issue plays out in your community. In Springfield, Mass, they were working on the issues of a teen pregnancy, and they gave cameras and said, what encourages teen pregnancy in this community and what discourages it? What promotes safe sex or responsible sexual behavior? And they gave the kids cameras, they went out and took pictures of the community, and they came back and then they put a display on of the pictures with the stories as seen by the young people at the library. And you attended existing community meetings. I said that at the start. When you go out and you ask people questions, the traditional questions I said earlier, what are your needs and how do we, the providers, meet them? When you're doing it to engage people, you also say, what are the community's strengths? And how can you contribute to helping us find a solution? The second part of that says to them, I want you to be a partner with me. You're not going to be my client. And the first part of that says, this community has strengths. You need to teach me about them. And if you do nothing else after this webinar, next time you do a needs assessment, ask that question. You're going to learn so much more about your communities than you never knew before. Here's another story. This is a Cleghorn Neighborhood Center. It's a small Hispanic neighborhood center serving 4,000 people in the city of Fitchburg, which is about 35,000. They had really lost their way, and we helped work with the board to redirect where they were going. They'd become kind of a service organization, and they'd started off being a neighborhood building association. And so we started by they only had 2 or 3 staff. They started going door to door and asking the questions, those 4 questions. And we found lots out. We found out that there was a very high illiteracy rate, not only in English but in Spanish, which helped us think about what we were going to need to do. But we also found a lot of people who were willing to work with us. So we brought them together afterwards and we said to them, okay, what are the issues and what are the strengths? And when they labeled the strengths of the neighborhood, of the Cleghorn neighborhood in small groups, and we wrote them up on the board, they broke out into applause because no one had ever asked them about the strengths in their neighborhood before. So that was pretty amazing. And then we started to do leadership development with them, and we began to take action around identified issues like traffic safety. But they became our partners through the leadership development. They wanted a Spanish GED program, which we then, although we had almost no resources, figured out a way to do. But we said to them, if we do that, we also want to give you the leadership development training. And so they'd have 3 GEDs and then 1 leadership development. At the end of that, they took the class at the local community college, and they didn't feel like they were dealt with very well. So they came back and said, you know, that leadership development, we want to talk to some of the people at the community college because they put us in the back of the room. They wouldn't speak Spanish. They wouldn't allow us to speak Spanish. We were treated as second-class citizens. And so they did. They met with the college. The college made all kinds of adjustments and changes. And that group of parents became our core leaders on many other issues. So you get a great resource when you invest in building the neighborhoods. People often say to me, oh, I would love to do it, but we don't know how. And I send them invitations, they don't respond. Well, we know some things that work. Mini grants. If you haven't done mini grants, think about how you do mini grants targeted at the population you want to reach. Leadership development. That was the example I just showed you from Cleghorn. We taught them to be leaders, and they were incredible resources for us. Again, a small investment of dollars. A bigger investment is to do community outreach workers, and that's very popular in public health now. I hope it's popular in Kentucky. But those are people from the community who are doing the outreach and are therefore always face-to-face in touch with people in their homes. And then finally, community organizers, which is another step, which is really bringing someone in to organize those communities so they can have their own voice. So you can't just say we don't know how to do it. These are, especially the mini grant leadership development, is not a huge investment of resources when you know what comes back to you when you have community leaders. Let me give you a final case study, and this was in Boston. I referenced it once or twice already. Excuse me for a second. Racial and ethnic approaches to community health. They started off looking at breast and cervical cancer. And this was a flyer, a banner that was in the back of every bus in Boston for a number of months. And this was the coalition. Pink isn't the only color associated with breast cancer. And this was a group of amazing black women who all had experienced one of the two cancers, and actually no, this is all breast cancer, and who are working with as a coalition to work in the community. The first flyer that went out said, "It's about us, strong women growing stronger. Fact, if you're a black woman living in Boston, you have a greater chance of dying from breast or cervical cancer than a white woman. Why? Racism may play a key role in determining your health status." This is putting a fact that everybody knows and no one wants to talk about on the table. And this brochure brought lots of black women to the table, to our coalition, because we knew what was going on and were willing to say it bluntly to them so we could all deal with it. And again, I know that the racial mix in Kentucky isn't large, but it could be about many other things and groups that are in some ways placed at a lower level. What Barbara Farrar, the commissioner, says is the role of the public health department is to create a space for residents to come together, to define a problem, to define the solution, and then enter into a dialogue with us, not the other way around. You better figure out how you're going to get the people affected by the problem at the table, because if you can't do that, you can't support that work. Somehow you're not going to get to solutions you need to get to. I thought that was brilliant, and I think that quote could be put on the walls of most of your offices just to keep you focused on what we know works. I don't think I'm telling you anything that you don't know, but as a field, we've wandered from this. And we're not, if we don't figure it out, as she says, we're creating things that don't work or that only attract the least risky people. I discovered that the coalition was basically ours. This woman took ownership of that coalition. Now, we worked in one neighborhood, and this will be the conclusion, in Jamaica Plain, which is one part of Boston, that's half white and quite affluent and half black and Hispanic and really struggling. And this is a great example of a community really taking on our work of working on health equity. We work with youth in a youth coalition because the youth are already involved, and it narrowed the focus. It gave us some place to start. And the goals were to involve the residents, examine health disparities, identify causes, develop a common language, and define and implement programs. And we worked from a health equity, social determinants of health framework. Through this, we know that our health outcomes on the right are determined by the social determinants, social capital, education, transportation, and that the health outcomes are only maybe 25, 35%, depending on the studies you read, affected by health access to health services and health behaviors. And that's where the whole national discussion is about, that, is if that's going to determine health outcomes. Well, black women who are college graduates have infant mortality rates the same as white women who don't graduate from high school. So that says that all these things are often changed by issues of racism. And so they're looking at not who are the racist individuals in all these systems down the middle, but how are the racial structural racism history in these categories affecting people's health outcomes. If your housing is an impact on your health, and we know it is, then at the end of World War II, the black soldiers who served did not get access to the GI Bill so they could buy a house. But most white families did. And so many of your families will go back to the first house that was owned, which was through GI Bill money that then got passed on, worth much more to the next generation and much more than that to the next generation. And so we have social capital and we have actually material capital based on the history in these systems. So we need to look at that when we're approaching things. And that's what we did with the kids. We gave each one of those social determinants, and we called it a bucket. And this was the goal, that they all have in each of these categories: high quality education, meaningful jobs. Each of the buckets was the goal. And so we looked at, for example, youth employment. And we gave them a case study about a youth who was having a terrible time finding a job, where she really wanted a job because she was living in public housing with her mom and they barely had enough money for food. The health impacts, so those kids saw that as a case study. They said, well, these employment economic inequities for young, low-income youth are going to have health impacts. She could get pregnant. She could start smoking. She could become obese. And the role of institutional racism. She's not getting that job because we know that none of the stores on the main street in Jamaica Plain hire kids of color. And then they went to possible action steps. And they charted this all out. And on the chart on the right, they graphed out institutional racism as seen by the youth of Jamaica Plain. They put Kimberly in the middle as a typical Jamaica Plain adolescent girl. And they put down the major institutions on the circles around, on the sheets around them: law enforcement, healthcare, schools, parks and recreation. And they had three colored dots. One was for if this institution supported Kimberly, one if it was blocking her progress, and one if it was neutral. And the kids could very easily distribute those dots around, step back and say, this is a picture of Jamaica Plain and what it does to all the institutions do to a young person like Kimberly. So it really provided a map, a very complex issue. Mapping racism in a community, the kids could do it if we gave them the task in an hour. They came up with the idea of doing job development, communications, job training, helped with developing a resume in the schools, and then they joined a march across the city, across the state, to push the governor to put more money in for youth employment for the summer. So that's an example. And then they issued a report called Health and Youth. If you know what this is, the report is for you. That container on the left is called a teeny. In the Hispanic neighborhoods in Jamaica Plain, that was sold in the corner store, and it's just sugar water. In the white neighborhood, fruit juice was served. And then they took each one of the social determinants of health and talked about what they learned, and that report was distributed. So it was engaging those most affected, who then told us what it was, and then we put it in a report and circulated it. What are the rules coming out of this? Embrace the value and benefit of community engagement. I promise you, if you follow some of these steps that I've been laying out, you're going to have wonderful experiences. You're going to have frustrations. It's difficult. It's not easy. But the end result is going to be amazing. Go out into the community. If you just add an hour or two every week to your job, I know, where is that going to come from? But out into the community. Recruit from those most affected in the informal sector. Don't just go anywhere. The people you need at the table are those most affected from the informal sector. When you get them there, share decision making and work to retain those you recruit. Be optimistic. It feels better. This is not easy work, I assure you. I know it. I've been there. I know the struggles. But I think being optimistic is the attitude to take. And here are a series of resources: my website, the Global Journal of Community Psychology Practice, and the Community Toolbox. If you don't know about the Community Toolbox, it's 7,000 pages of free downloadable material. And my website also has hundreds of pages of free downloadable material. And then there's my book. So let me now go back and see where we are in terms of questions and discussion. I'm not hearing anything. Anybody there?
All right. Hi, Tom. We did have some questions come in. Let's see. Where do you get money for incentives?
For incentives, people can, I mean, again, if the incentives are $25 a night for a meeting, and you have 10 meetings, 2 months off, 10 meetings a year, that's $250. And, you know, it's not a large amount of money to squeeze out from somewhere. Again, 4 $250 mini grants, it means you're finding $1,000. And many grants have some discretionary money for doing programming on any of these topics. And this is certainly programming on these topics. So, you know, I think you find it in the existing grants. I mean, you could also go looking and apply specifically for that kind of stuff. And there are sometimes foundations, local community foundations, put out money in small amounts for things like this.
All right, this is kind of the same question. How can you provide stipends for attendance, etc., without creating the expectation and discouraging participation when it is not possible to provide those stipends?
Well, that's an interesting question. Presently, the world is full of only the latter, which is that we don't provide that. There are no incentives, and we have a terrible time in getting them to the table. So my hope is that this talk shows you, you know, let me put it this way. We would go way out of our way to figure out a way to get the head of the hospital to join our coalition because he's going to bring so much. Well, you know what he's going to bring. He's going to be able to attend 1 out of every 8 meetings, and he'll send some assistant that maybe he'll attend to it. I try to show today the incredible value that having residents at the table will bring, in which case we say that's the value of them being there, and therefore we need to find the money to pay them now and then to keep showing how that payment paid off. Because we had parents at the table, we were able to develop these amazing programs that really are having an impact, and therefore in the next grant we're going to write in more. It may go back that it goes away. If it goes away, we're back to where we are now, which is we have no incentives, and in many states, I don't know you, you're not there, we're not back and forth, but in most communities I get to, we don't have parents at the table. So I think the situation can only get better.
Okay, what are some examples of effective decision-making structures or models that best promote community collaboration?
Great. That's an excellent question. There are a lot of techniques that aren't just about decision-making. You know, one of the things I like to do is if we're starting off a year and we're saying, what are some of the best things we could do this year on opiates or obesity, and we brainstorm a series of ideas, then I use priority dots. You buy those little sticky dots, you give everybody 5 dots, and the resident gets 5, and the head of the hospital gets 5, and the head of the health department gets 5, and you go and put your dots on the issues that are up there, and that's a very clear piece of democracy. Most dots gets the action. I mean, you don't. It's even clearer than elections because it's instant. You see exactly where the votes are, and so that's a technique that works. I think you can also talk about, how do we do consensus? And I was recently in a where we, if you have disagreements, how do we do that? Well, everybody gets given a card that says agree, disagree, uncertain, and you keep talking it through. When everybody flashes the card for their vote when it's time. What happens when residents are in the room, people with less power, people who are used to the system treating them as second-class citizens, and that can be about race, it can be about rurality, it can be about education, it can be about economic level. They're less likely to participate, and we have to bend over backwards to make sure that they have a say and that we don't dominate because we as professionals are so smart and have the answers to begin with. You really want to undo that. And so you create mechanisms where everybody always has a voice. So if in any exercise I do with a group where you give an exercise to a table, I always have everybody do it individually first, then share it, and then as a group come to a consensus about what the decision is. So you're building, and it's slow and it's tedious, but it's always getting the voice of people heard. And that can also include professionals who are quiet or shy by nature, because usually what we hear in coalitions are those who are loudest. And after a while, we get tired of hearing those who are loudest. I hope that helps.
Thank you. This is just more or less a statement. Thank you so much for raising the perspective. This perspective, race matters in Kentucky, class matters in Kentucky, rural places matter in Kentucky.
Great. Right. I can totally agree with that. And I think often we feel that as like, radical political pushback. But take a look at our data on health and what the health disparity data tells us. And it tells us that we're doing a great job. Many people are getting healthier, but not certain populations. And that's got to be our priority. We can't say, oh, we deal with disparities by dealing with people who are left-handed and people who are doing this and who are all the different oddities that can be out there, as opposed to saying, what does the data tell us? What are the data about who is experiencing bad health? And let's start there. And that's why, Black Lives Matters, and I don't know what the other three were, but that's all getting at that issue. That makes sense?
Yes. We've got another question. Do you have any tips on getting teenagers in health education and engaging them in seeing health outcomes and how they can help? They have a very present view of things. So are there any tips on making them see the importance of their involvement in issues related to them or how it can impact their future?
Great question. I start with having been the parent of adolescents a while ago now, but what we all know is it's very hard to tell an adolescent anything and expect them to listen and obey. That's not the developmental stage they're in. So I think what the literature has said again and again and again is we do it through peer counselors and peer outreach workers. So we turn to other adolescents who we train to be able to deliver these messages, and when it comes from a peer, again, the data says it's much more powerful. Now, again, like my story about picking the one kid who's going to go to Harvard to be the student representative, our peer representatives have also got to represent the diversity in our communities: ethnic, racial, religious, rurality, income, and you don't just want your best, smartest kids who everybody both looks up to and the people on the bottom don't have a lot of respect for being the deliverers of these messages. You want a real mix. So well-run peer education programs have a very strong history. I think the other one that I really love, and I've seen it work so well, is photo voice, where you take some of the young people and you send them out with cameras and they come back and they write their story. It was done in Springfield, Mass. On STDs. I've seen it done on violence. I've seen it done on issues of race. How are black kids treated in a small city in New Hampshire? And the kids went out and they took the pictures of the cops and the stores and et cetera, et cetera. And then they wrote a story that went with each picture, and they blew up the picture and they blew up the story and they exhibited it in the town library. Very powerful. Great way to get the message across to both the young people and others. So we're getting more and more tools. We're getting better at this. We started by having the cops come into the schools and say, these are drugs, don't use them. And we graduated from that to things that address exactly the problem you identify, which is how do you get young people to listen to messages? Well, just go online and look at social media, listen to the music. These are all ways that young people listen to things. We just got to be using those modalities as opposed to saying they need to learn this through my modality, flyers or whatever.
Okay, suggestions for handling territory issues among formal leaders. informal leaders and informal leaders. We've seen it within both groups.
Yeah. Yeah, I mean, the great dysfunction in our helping system is territory and turf. We're outrageous. And I think the hospitals will be any of you who's in a city with 2 hospitals, you know, their relationship to each other is not just competitive, they're trying to put the other one out of business. And then in the nonprofit world, I've been in a community where 2 small Hispanic agencies modeling on the hospital did the same thing. They only each had 4 staff, but they wanted to put the other one out of business. Competition is deeply embedded into our system, and it's totally dysfunctional. I don't see almost any value for it in the work we're trying to do around building healthy communities. So that said, you know, how do you deal with it? Well, one of the things that we do is there's a visioning exercise, and it's not in this material, but if you go to the community toolbox or you go to my website, you'll find it. And it's, you know, an exercise where you say to everybody, you know, where do we want to be in 5 years? And it's done through a newspaper article, headline writing, and then you say, okay, if that's our goal, are we in agreement on the headline and the vision? And even groups that are competing will do that. And then you have something to hang on to say, okay, so we are agreeing that this is where we want to go to. Can we all go there in spite of the fact that often we're in competition with each other? And sometimes, you know, the dominant leaders in the community are so dysfunctional and so dominant that we often look for building alternatives. So I've been in communities where we were building a Latino community in a big city in Massachusetts, and we had the sort of frontline and midline workers in most of the agencies who were Hispanic. There weren't a lot of them, but they were all in the coalition, but they refused to form a steering committee. And I couldn't figure it out. Our poor coordinator, if she wanted a decision, had to call 8 people or 12 people because they wouldn't meet. And then it turned out they finally admitted that the issue was that they thought if we formed a steering committee, it would be the judge, the head of the health center, and the head of the Latino agency who represented the Latino community in everything when they needed someone. And they, you know, needed to have a different set of leaders. And so when the Latino coalition emerged with this group of leaders, there was some balance to the dysfunctional power that those 3 people had. And that helped both groups, as a matter of fact. So we sometimes have to sort of work around it because you're working with people who are just so difficult and have been there forever and are used to just dominating meetings. Other very simple things you can do is you start a meeting by creating ground rules. You ask everybody, you know, what are the ground rules you want to have to run the meeting today? One person speaks at a time, we listen, we agree to disagree, you know, those kind of things. And you post it, and then the next meeting you come back and you post it again and ask if anyone wants to add anything. And then at the end of the meeting you say what worked and what didn't work. And you do plus, and as opposed to minus, I do delta, what could be different. So what worked out of this meeting, what didn't, remember going back to our ground rules. And they'll say, well, you know, those 2 agencies that are fighting, they still dominated that whole discussion, we got nothing done, and I've had enough. And you start to be able to label the disagreements. Interestingly, the research on substance abuse coalitions done 15, 20 years ago showed that substance abuse coalitions that labeled the disagreements and the conflicts in their coalition, they don't have to solve them, they just labeled them, had much higher rates of substance abuse reduction. So that just doing that has an impact on the actual community outcomes. I hope that helps. It's a very complicated question, and it's a serious. I address this in my book a bit, talking about the dysfunctions of our helping system that, you know, foster that amount of competition.
Okay, the next question, Tom, is our coalition is currently focused on obesity prevention of youth. The work was framed by agency-based partners, but we would like to deepen the participation of those most affected by the problem. How do we open this participation, and might we need to change the focus of our work?
Well, you might need to change the focus, but you first have to do the first part, which is widen your understanding. And I think you go to that list of tools and you say, which of these can we do? Can we go and knock on doors, or what's the equivalent of that? How are we going to get to sit down with young people and talk about obesity, and ask them, how do you see the issue? How can we help? What are the community's strengths? What fosters better health and better eating and more exercise? And would you be willing to work with us? And you build your army that way. But those opening steps, you could put out some mini grants for young people who are, from the community, be part of a $500 project, $200 project that they submit an application on to address this issue and get their ideas. You have to break the mold, because our mold hasn't been working. We're not getting them to the table. The message is going not only over the head, it's just missing them totally because we're not able to target it to where they're at. They will tell us. I have 100% confidence that if we can start to get into discussion with young people, they will direct us as to how to get this message out. But it's taking the tools that I just laid out. Again, there's more in my book, there's more at the website, there's more at the community toolbox on any one of those topics, like the photo voice, etc. But you get out there, you engage them, you make some partners, and then I would bring them on to your steering committee. And that may mean you're going to have to meet at a different time. Or it may mean you need permission from the school to meet right after school at the school. But when they're with you, if you've been around young people who are doing this work, they're amazing. And they're so much more creative, at least than I am, in terms of thinking about how do you get the message out. So I find it to be terribly exciting. Know you're going to miss the target now and then, but if you get close to talking with them, I knew I was working with a guy who was trying to get the message out to parents about substance abuse, and everybody said, well, the parents are too busy, you'll never see them, you never get them. But he created patches that you had to sew onto sports leagues, so everybody in the city was required, if they were in the sports league, to have that patch on it. It was some kind of substance abuse prevention patch. And they had to get on the uniform to play. Well, guess who had to sew on those uniforms? Let me tell you, it wasn't the dads, but it was 500 to 1,000 moms sewed on these patches. Maybe they sewed on multiple ones if their kids were on multiple teams, but they got the message. And then they were there on the sidelines, soccer moms. Well, yeah, right, soccer moms are at soccer games on the sidelines. And you can talk with them, and you can talk with the kids, serve some kind of food after a soccer game in exchange for chatting with the kids. The kids are there. I always say to people, think of yourself as Margaret Mead on Samoa. She was the great anthropologist. And as an anthropologist, you walk around and you say, I have no idea what this culture is like. Let me just poke around and ask around and sit around and listen, and maybe I'll learn. And I think that's the way we have to think about it. It's not that we should know what it's like to be a adolescent battling with obesity or not battling with obesity. We need to go in there and say, well, what's this like? Can I hang around with you? Can you chat with me? It's a culture we don't understand. And because we are professional public health people, we assume we should understand, we have techniques for doing it. It's not that easy. And I think it is really going back to those key things I said at the end. It's about going into the community. Start to go in. You're going to fail at some of this stuff, and some of it you're going to succeed on, but you're going to hate. So find the things that succeed and that you like and that are comfortable for you. Nothing's going to be very comfortable. We're most comfortable sitting in our office just with our computer screen. The computer screen doesn't talk back, and go out and do some of that.
Next question. If grant opportunities present themselves through an agency, is it a bad thing to pursue them without prior consensus of the entire coalition, if it truly addresses a community need? If not, should you let the opportunity for the funding pass?
Well, the answer to that should go to the funders, but they're the ones who put it out and say, I need a response by next week. I think we're often forced to write these things without being able to consult. But I think we all can do at least a little bit of consulting. and that is most groups now communicate by the web. That's instant. And so you can say, we got this email, it's due next Thursday, we're going to have a meeting Monday morning to start to plan. We need to only have 4 people in there because we got to divide it up and there are 20 pages to write. But please send us whatever ideas you have. If we get a draft, we'll circulate it to you. Anything you can do. That shows we know what we need to do now is reach out. The funding system undermines everything I said today because it says you got to do this, you got to do it quickly, and we don't demand that you have input from those most affected, and we'll give you money anyhow, and we trust that you as agencies have the best ideas, and very often that's just a disaster. So but we're not in control of, well, not everybody in the room here is in control of that, so you can try to do the best you can around that, but the less that is secretive, the less you're going to have ill will later on. But it's a very good question.
One of the things that I say often at coalition meetings is that we are a community and must be community for all to succeed. So in order for us to obtain our common mission that we have decided together, we must work together. None of us have enough personnel or resources to do all that needs to be done, but together we can do great things. When we look at the outcomes and able to say the community did this and not try to assign stakeholders the credit, then we will be community and healthier. That was just a statement that someone made.
Right, and that's a great statement. Where it runs afoul is when we say all of that in the beginning, and then we have a project that's got a deadline, and we try to get the volunteer committee to work, and we get a little impatient because we are, and again, I'll speak for myself, but I'm sure there's 50% of the room who can nod in agreement, are control freaks at heart. We like things done right, and I don't want to submit something that looks sloppy, and so therefore we move in and we do it because it's easier to do than to try to call 4 people to say, let's do it together, and we start to undermine our statement that this is about all of us and we all share the responsibility. And so when we really believe it, we have to stick to our guns and make sure that our behavior, our anxiety about outcomes, our control freakness, all of that doesn't get in the way of sticking to the message, which is this is about all of us. And it's very hard to get a coalition bought in enough so they'll actually share responsibility. And then when that's happening, our job as coalition leaders is to be a cheerleader. I always think a short skirt and pom-poms, would be my outfit, because you really want, and you saw my picture at the beginning, you know exactly how cute that would be. You want to be underlining how we're doing together and where we're not going along with the competitive mode, and how that statement was written, that it's all about us working together to make this happen. So it's a great vision, and we just have to look at how do our behaviors encourage it and how do our behaviors discourage it.
All right, last question. When working in school health, what tips do you have on getting educators on board with the importance of health and its impact related to students, their families, and the community? Are there good tips on getting common purpose and understanding of what is needed to be changed for physical and mental health in a school setting to ensure that the safety and good health outcomes for the future?
Great question. It really is, the answer parallels how do you go into a neighborhood? How do you go into a community of those most affected? I think, having done a lot of work with schools and been on a school committee and therefore somewhat on the inside, schools perceive public health people as coming to them and lecturing them and saying you need to adopt this and you need to adopt that, just as residents feel you're coming to them and saying eat better. And that's not our intent, but it can be the way it's heard. And so I would go back to what I said earlier, which is you build a partnership with the schools. You go and you listen to them. You talk with them. You ask how you can be helpful, what's on their agenda that you can be helpful with, as opposed to sort of saying, here's what my grant has and here are my demands. some of the worst examples of this is where we get some money to do a curriculum change in the schools, and we use the money to pay our staff people to go in the schools and teach, because they say, oh, we have nobody who can teach this, and we don't have any time. So we teach whatever, exercise, obesity, anything, you name it, for 3 years. Then the grant is up, and we turn to them and say, okay, now it's yours. And they look at you and you say, you're out of your mind. As opposed to taking the money that we're using to pay our staff to teach it and saying, we have the possibility of doing an education program for sixth graders. We'd like to do it in partnership with you. We can bring some resources to the table. Let's do this together for 3 years, and maybe as you see it succeed, we can go to the school committee and the department heads and convince them that this is of some value. We have to lure them in. Just like I suggested mini grants, same kind of thing. Let's figure out strategies that get schools to buy into being partners with us, because there is a lot that's good for both. But I don't think the way we often, we're often put in very short terms. Call the school, make sure they'll sign up for this grant. And if you don't have a relationship, it's just someone else calling the schools, putting more work on them, and they're overwhelmed. So it's about relationships, it's about building partnerships, it's about, if you do a project with someone once, staying in touch so that you can go the next step with them. But a lot of that's relationship as opposed to, here's the formula. It's about having the schools see you as a partner that has a mutual goal.
Okay, now we have 2 more questions.
I thought that was the last.
Well, we had 2 more come in. Sorry, Tom. What ideals do you have for promoting community engagement when the community is actually a rather large geographic area that consists of multiple communities?
You answered it. You deal with it as multiple communities. I mean, the fact that someone geographically calls something Smithtown doesn't make it a community. The community will tell you what's a community. I did the first major coalition, the one I showed you with the plant closing. It was first called the Athol Orange Community Coalition, because now it's called the North Quabbin, because that's the region. But it was called Athol Orange because a lot of things they label up there as Athol and Orange, the 2 major towns, Athol and Orange. But in fact, there's a county line that runs between them. So Orange is part of Franklin County, Athol is part of Worcester County, and all those county-wide programs, which I'm sure work like in Kentucky like they do here, wouldn't have those 2 towns working together forever, for anything. And so we had to go to war with all those counties and with the state and say, you may call it Orange, Hampshire County, and Athol, Worcester County. We know it as the Athol Orange community. We are one community. We understand that when we're solving problems for each other. The 2 major towns, east and west of us, are half an hour to 45 minutes away, and we're not part of them. We're Athol and Orange. And so, we get taught what is the community by listening to the community and not listening to the geographic lines. So when you describe that, I wouldn't treat the large area as a community. You said it. Within it, there are all these subcommunities, and better off to deal with 1 or 2 of those subcommittees well and build a relationship that you could then show off to neighboring communities than to try to do something in 18 subcommittees.
Okay, we have a question from someone that's here in the room with me.
So when you're working with, for example, these youth coalitions who identify these isms, classism, racism, and some other things in the community that are hindering their efforts, and you go back to these organizations and agencies that are providing services, what if they're not ready to address the elephant in the room, the big R? What if they're not ready to change the cultural norm within the organization? What do you recommend? Because that's disheartening sometimes to these coalitions to identify the issues, and then the larger establishment is not ready to address them. What recommendations do you have to get them to move their agenda forward?
That's a beautiful question and a critical one. I mean, certainly you do not want to send these magnificent young people who've done this analysis up against the major systems and have them beaten down. But there were parallel efforts. while we were doing the youth development work that you saw in those slides, we also had a Jamaica Plain Health Equity Coalition that had a lot of the agency heads, many of whom were people of color who'd been fighting civil rights battles for years, so they were pretty sophisticated. But we also had some agencies that had no clue. And so we did education programs. We brought in speakers. We had a workshop that happened every other week on racism and health that really went through the basics. So you're always trying to modify how the systems see things. And in fact, when we developed principles for the coalition based on racial justice and health equity, we also asked that every one of the member agencies take this back to their organization and get them to endorse it. Well, that wasn't so easy, and then it wasn't always endorsed, but at least they got the message from the coalition that this is where we're headed. And then we would bring the young people into the meeting with the agency folks and have these joint discussions. And Abby, who was the youth, I learned all this from the youth organizers, but she used to give the young people a sign that was blank on one side and said boring on the other. And so if we wandered off into jargon talk or nonsense that didn't really have anything to do with them and making things better, they were allowed to flip the switch and flip the piece of paper over, and you'd see all these signs popping around the room saying boring, and we knew we were losing them, and it was time to tune back into what they needed. So it's you're identifying the need for us to systematically address getting our institutions, both within health and outside of health, to be responsive to issues of racial injustice and health disparities and health equity. And that's a huge task, but if you ignore it, then you're setting up the young people to be defeated when they go out there, and we need to support them. And an example of what happened under jobs is really interesting. Jamaica Plain has one street down the middle called Center Street, where all the stores are. And as the young woman in the example said, there were none of those stores would hire kids of color. So the coalition set out a plan, and we went to one of them that was the friendliest. It was a new sandwich shop, and we said, our coalition members are going to buy from you, and every time they buy, they're going to let you know it and track the amount that we're spending. And at a certain point, we want you to hire an intern will be a kid of color from the neighborhood to work here. And that may not be the exact way they worked out the finances, but it was something like that. And it's not that they paid them, they just sent business their way. And the kids became part of that as well. And they hired the first intern. And guess what? The intern became an employee, because, of course, when you have a kid of color on the street with lots of other kids of color coming in and out, the kids are going to know this is a good place to go, and it was good for business. And now they followed another store that then did that, and they start to create systems change, and the kids understand it because the feedback comes back to them, and they feel empowered to be part of moving those systems. So it's a great question, and it's part of our ongoing struggle for racial justice, which has to be at the core of the work we're doing. So thank you. You've had wonderful questions. I hope this, one of the frustrations doing this is I don't see heads nodding or shaking the wrong way. So I hope you are in tune with this and some of this was helpful. Pursue the tools and the toolbox in my website, and you'll find many more free materials in your work.
Thank you, Tom. We were all nodding in the room here, just so you know. This was really informative. This is really, really great. The next part of the webinar is going to address the chat RFP that went out. So this is for the local health departments that received this. So other participants, you can sign out, or you're welcome to stay and listen if you want to. Just remember that this is an application for the local health departments. If it's something that you might be interested with it, contact the health department in your area. All right. You should have received the RFP. It went out a couple of weeks ago. Are there any questions?
Right, but it's not. That's not exactly what health equity is. Just well, we can talk about that. I don't know. I think we could have done a better job of it.
All right. Any questions? All right, one of the questions, it lists equipment that can't be purchased. Can you define equipment? That is any kind of major equipment, copiers, computers, things of that nature.
Does it include iPads?
It does include iPads. Tables, chairs, and tents, would that be under that? Unfortunately, yes, it would. Some suggestions first. What are some suggestions for how to spend so much of the funding toward a coalition? One of the suggestions that we've made is to offer mini grants in your neighborhood. If you've got a neighborhood coalition, if you've got some kind of something in the schools that you want to work on, offer it to the schools. Do you all have anything to add?
They wanted to fund for leadership development. They need
Yeah.
a consultant.
Right. If you want to pay a consultant, if you want to fund leadership development.
We have a nonprofit, and one of our that's a recipient of one of our CHAP grant funds, and she works in the community that's in a high-risk zip code, but she also has a nonprofit. So she's mirrored her work with her local agency with her nonprofit and doing great work in the community, and used a mini grant to do that. So.
Okay, so those are some ideas.
And the stipends that he mentioned would be a good way to use the funds.
Mm-hmm.
So.
Do we need to do a new application if we want to continue with the current program we are doing this year? Yes, you do. For Section 4, do you want us to provide a list of all partners in the text box, or is an attachment okay? An attachment is fine. There was some confusion that when the RFP went out, and that was my fault. The application is due Tuesday, May 30th, not on Monday, May 30th, which is a holiday. Another question. The local health department can submit more than one application to encompass several coalitions. Yes. Any other questions?
I have one. So if the health department submits multiple applications, does the total have to add up to 20,000, or can it be two applications totaling 40,000 if they do two separate ones? Or two?
They can submit, yes. Yes, they can. It's going to be based on their application. It's going to be based on their budget, and it's going to be based on how it's scored by the scoring committee.
So they can get up to 40,000?
They could.
Okay.
They could. Section 3, do we just need SMART goals and objectives, or explanation of a timeline for the SMART goals is needed? Let me look. Well, you need both. You need to include the SMART objectives and the activities, and along with the timeline. How much of the money is to pay for staff? 50% of what you're awarded can go for staff time, travel, indirect. Can an application reflect more than one coalition, or do separate applications need to be submitted? You could do it either way. You could reflect more than one coalition, or you can do a separate application for each one. Can you use funding to help with a community health assessment? Yes, you can. Do we have till close of business on Tuesday to submit the application? Yes.
Where did you say? This right? Where would you?
Can funds be used for food? No. The funds cannot be used for food. What we've told others that have asked that question is a lot of times you can get donations for the food, but these funds cannot be used for food.
Tom suggested using stipends to pay people for coming so they can have their program. That was a suggestion.
If we offer mini grants, can work groups inside the coalition apply for those grants, and are there stipulations on what mini grants can be used for? There are no stipulations really, but you would want to make sure that it's something that needs to be addressed in your community, some type of health or safety concern that needs to be addressed in your community.
And get at the community that's most affected.
Yeah, and you're right, Elaine. The community that's most affected has to be engaged. What other projects have been funded? This is a new RFP, so we're open to suggestions. In the past, different things have been funded from obesity prevention, healthy communities, safe communities, built environment. Those are just a few of the things. Can funds be used for program incentives? Yes, they can be used for incentives, but be careful with that. You know, you don't want to just be real careful with the incentives. Can each county health department within a district health department apply, or apply as one? No, we want each county to apply. Any other questions?
You all have anything?
Oh, here's a few more questions. So we could offer stipends for attending community forums on issues identified in our chat. Yes. As long as they're not an employee of the health department.
Right.
It's for people in the community. Is a pedometer considered equipment if we're using it as an incentive?
No.
No. Any other questions? Can stipends be provided for speakers? Yes, as long as it's addressing the focus that your coalition decides it needs to be focused on. Is the amount of the grant funds the same as last year? No, we've increased we've increased the funding. We're funding fewer locations this year, but we've increased the funding. It's on the RFP. We're giving out approximately 25 grants for up to $20,000. Depending on the application, depending on the budget that the review committee approves, it could be a little bit less, it could be up to $20,000. Someone said that there's a lot of questions regarding on what the funding can and can't be spent on. Just email me those questions that you have and I'll address them individually. All right, another question. If we purchase iPads for CHA survey, is that equipment more productive and efficient than entering a paper survey? That's something I'm going to have to run up the chain to our project officer. We were told before that no, we couldn't use the funds for that, but I will ask the project officer about that again and get back to you.
That's equipment, so there's a kind of a gray. That's why I asked about iPads, because it is easier.
We are a district health department serving 4 counties. I plan to offer 4 $1,000 mini grants to each of our community health collaboratives. Does each collaborative need to apply individually, or can we apply as a district? Each collaborative would need to apply individually because the focus may be different in each collaboration. The deadline cannot be extended because it just can't be extended because we have to have time to convene and score the applications. Can podcast radios be purchased for a school PA system? That's something else that I'll have to ask the project officer because that's considered equipment. Can funding be used toward needle exchange? Yes, funding can be used toward needle exchange, but keep in mind, Kentucky's getting, I think, is it $10 million for substance abuse? So there's other funding out there, so you may want to use this funding for something else. You cannot use this funding in any way to purchase needles. It says specifically in the grant that we can't use the funding for that, but you can use it to support the needle exchange program. But like I said, keep in mind, Kentucky is getting a lot of money for substance abuse, and you may be able to pull down apply for some of those grants that will probably be going out to the communities. Do we come up with mini grant applications? Yes, you will be expected to come up with your own mini grant applications. You are also expected to do the reporting from the mini grant applications. We can provide a little bit of technical assistance for that. We can send you a template. If that would be helpful, just email me and let me know. All right, well, there seems to be no more questions. This will conclude our webinar. Thank you all for attending. If you have any other questions, please just shoot me an email at shelly.canada@ky.gov.